Hi everyone, and welcome to our presentation on sensory integration and processing. There are several objectives that you should be able to complete once finishing our presentation. First, you should be able to outline strategies to create a sensory-friendly waiting room area for a child with sensory differences. Next, you should be able to explain how OTs can use their expertise to modify waiting room environments. In addition, you should be able to demonstrate knowledge on literature of sensory-friendly experiences for children. And lastly, we want you to be able to justify why Rush University Children's Hospital would be an appropriate setting to incorporate a sensory-friendly waiting room. The study we chose looked at OT's role in creating sensory-friendly waiting rooms, such as at the dentist, doctor, or therapy office. OT's unique ability and skills to evaluate an environment make adaptations in order to facilitate ideal arousal levels. In this study, an OTD resident worked alongside a dentistry department at a national rehabilitation center to assess their waiting room and provide suggestions and changes to their waiting room in order to make it more sensory friendly for their patients. After evaluating the waiting room through observation, the OT was able to use their own experience along with information in the literature to make changes to the waiting room, such as visual, auditory, tactile, vestibular, and olfactory modifications. More about the OT's evaluation findings and suggested modifications will be discussed in the next slide. The overall goal of this study was to adapt the environment in order to eliminate noxious stimuli that could be bothersome to some patients, whether they were sensory sensitive or seeking. While the effectiveness of these changes have not yet been measured, it is expected that the effect will be measured in looking at patient stress, anxiety, behaviors, and perceptions regarding the sensory aspects of the environment. So now we're going to take a deeper look into what was done within this study. As we said, an OTD student consulted with the dentistry department at a national rehabilitation center to provide recommendations to make the waiting room more sensory friendly. Before making any recommendations, the student sat in the waiting room at different times throughout the day and observed. What they found was that the TV was always on and very loud, although patients rarely seemed to be paying attention to it. The dentistry tools were audible, loud noises carried in from the hallway. There were many flyers on the wall. The overhead lights were very bright. Leather chairs with thin armrests placed side by side were the only seating option, and some patients preferred to stand and walk around during their time in the waiting room. After gathering this information from observing, the OTD student used literature and clinical experience to provide recommendations of evidence-based modifications to bring to the waiting room in order to reduce anxiety. Some ideas were to replace the lighting with natural and soft lighting, hang nature artwork, remove the flyers, install soundproof doors, play calming music, provide various seating options, and supply fidgets and weighted blankets. Currently, these modifications are being implemented and effectiveness will be measured for the future. In terms of measuring effectiveness, there are a variety of ways to do this. This could be done by measuring patient stress, anxiety, perceived sensory aversion to the environment, and satisfaction. When it comes to measuring sound differences, this could be done by using sound assessments, while other areas can be measured by comment boxes, patient report surveys, and structured observations. Here we have some literature about sensory-friendly and calming environments. In an article by Wood et al. In 2019, nurses modified the emergency department of a hospital using evidence-based practices and by collaborating with the community to create a more sensory-friendly environment. The study found that these modifications created a more peaceful and healing environment that was accessible to all. In a study done by Liddy Coate in 2020, researchers examined the effect that waiting rooms had on anxiety levels, comfort, therapeutic relationships, outcomes, and perceptions of care. They found that strong emotions can be provoked by their environment and the importance of space and sensory modulation in creating a stress-free waiting room. In a study done by Chalmers et al. In 2012, a literature review was done to identify sensory-based approaches to mental health in an inpatient psych unit in Australia. These approaches were then implemented in the inpatient psych unit for 3 years. After 3 years, the data showed that a significant decrease occurred in patients' distress levels as well as acute arousal ratings. This study shows how sensory-friendly approaches can decrease distress in patients and be applied to all hospital settings. Another study done by Duker et al. In 2019, surveys were completed by adults with ASD, their caregivers, and their primary care physicians. The survey examined perceived barriers to going to the PCP and ways to improve care. The survey found that sensory challenges were a perceived barrier and there was room for improvement. In a study done by Buchboom in 2012, they examined if real nature or artificial nature impacted the stress level of patients in a Dutch hospital waiting room. From 457 patients, it was found that patients who were exposed to real nature or pictures of real nature experienced lower levels of stress. It was also found that the attractiveness of the waiting room also impacted stress level. This study shows how nature can be implemented in hospital waiting rooms to create a calming environment for the patients. Overall, this research highlights the importance of a sensory-friendly waiting room for patients and provides data that shows sensory-friendly environments impact the patient's experience at whichever healthcare provider office they're at. So for our local organization, we have chosen Rush University Children's Hospital. Rush University Medical Center has a mission to improve the health of the individuals and diverse communities we serve through the integration of outstanding patient care, education, research, and community partnerships. Their vision is for Rush to be the leading academic health system in the region and nationally recognized for transforming healthcare. Rush University Children's Hospital offers a wide variety of services for children throughout the Chicagoland area, including primary pediatric care and more than 25 pediatric specialties at its 3 hospitals and several satellite locations. As of now, Rush University Children's Hospital is not sensory friendly. Visually, it has bright fluorescent lights, busy artwork, and bright walls, and lacks natural sunlight. There are limited seating options and a lack of materials for children to play and fidget with. In order to create a more sensory inclusive and anxiety-reducing environment, Rush could adapt the lighting and wall colors, add artwork featuring nature, provide various seating options, and play calming music. As we discussed earlier, Rush's mission and vision is to provide outstanding care for a diverse population and be nationally recognized for transforming healthcare. Outstanding nationally recognized care should include evidence-based practices each step of the way, beginning in the waiting room. In addition to the lighting and seating fixes mentioned on the previous slide, Rush can also incorporate sensory-friendly modifications such as noise-canceling headphones, quiet rooms separate from the main area, a basket of fidget toys or objects, and weighted blankets or lap pads. Rush University Children's Hospital aims to provide client-centered care to a highly diverse patient population each day. This means catering to children with varying sensory preferences, whose visit starts in the waiting room. Having an inclusive waiting room can help eliminate the anxiety so many children face when visiting the doctor's office. In addition, this would support the patient population with sensory processing difficulties and help them access care in a more effective way. As OT students at Rush, we all understand the importance of adapting environments in order to help our clients participate and engage in their daily activities. With this, it is important that we consider the importance of adapting unique environments, such as waiting rooms, so that all individuals will feel safe and comfortable when in them. Considering Rush University Medical Center's mission to improve the health of individuals in diverse communities that they serve, they must also consider those that they serve which experience sensory differences. They first must start with the Rush University Children's Hospital, as a study done by Ain and colleagues in 2004 found that 1 in 20 children experience sensory processing disorder, with this number likely increasing since then. This number includes many children with co-occurring diagnoses, such as autism, ADHD, or depression, whom likely spend many hours in waiting rooms. OTs are experts at creating a match between the person and their environment. For this reason, they should be considered to have a valuable role in creating these sensory-friendly environments. With our role as OTs focusing on an individual's ability to participate in their daily activities, this includes their ability to participate in health management tasks, including medical appointments. Sensory stimuli can change individuals' behavior and participation, which are important to consider when a child is expected to behave a certain way or participate in assigned tasks, such as one at the dentist or therapy appointment. Lastly, as we stated initially, the waiting room is the first place someone goes to when attending a doctor's appointment. Given the anxiety-provoking nature of many medical appointments, it is imperative that the waiting room is considered in the entirety of the appointment. The feelings and experiences an individual has while in the waiting room will dictate their feeling about their appointment, as well as how well the appointment will go. Providing waiting rooms that are friendly and comfortable to all, we are taking the first step in providing excellent, equitable health care for all individuals. As you can see, there are many reasons in which all medical offices should be implementing sensory-friendly strategies and design into their waiting rooms. Not only is it important for the comfort of all patients, but it can dictate the entire healthcare experience for many individuals. Please read these 2 discussion questions and post your answer on the discussion board on Blackboard. We are looking forward to hearing your thoughts. Here are our references. Thank you for listening to our presentation. We hope you enjoyed this topic as much as we did.